Hey guys, this is Dr. Hub. Today we'll look at the triage color grading. So the triage color grading. So first is we need to know that they are divided into the red, yellow, green and black. So first we are starting with the red. So the red, it needs immediate resuscitation or the surgery. So this immediate resuscitation or the surgery should be done immediately, and this is done in the next 6 hours. Is done in the next 6 hours or transfer. So it may survive if timely medical interventions can be given. So the person can survive. So what are the examples of the red? So red, the examples can include, there can be the tension, pneumothorax. Then comes the airway obstruction. There is also the airway obstruction. Then comes the hemothorax. There is the hemothorax. Then there is also the cardiac tamponade. There's acute circulatory arrest. There's acute circulatory arrest. Then there is also the major intra-abdominal bleed. So also major intra-abdominal bleed. Then we move on to yellow. So yellow means it is a medium priority, and this means that the possible resuscitation or the surgery in the next 24 hours. The resuscitation or the surgery in the next 24 hours. So the person is likely to survive, a prompt treatment is given. So they are likely to survive. Likely they survive. So what are the examples of the yellow color code? So the examples here, it includes, there's a compound fractures. Then there can also be the degloving injuries. There can also be the presence of the pelvic fractures. There is a spinal injuries. And there is also moderate head injuries. Then we move on to green. So in terms of green, there is a low priority. So what does it include? It includes the ambulatory patients or minor illness. This includes the ambulatory patients or the minor illnesses. And in green, they are likely to survive if treatment is slightly delayed. So they can survive, and this is even if the treatment is delayed. If the treatment is delayed also, so even if they are delayed, it can be able to survive. So what are the examples? There are the simple fractures as well as the minor lacerations. They can include the minor lacerations. Next we look at the black. The black is basically the least priority. There is least priority, and this can include, there is a dead or morbid end patients. Dead or the morbid end patients. So what are the examples in terms of black? The examples, it can include the severe brain injury. The severe brain injury. Next comes this major damage. There's major damage or the disruption to chest wall. There's disruption to chest wall and abdominal structures.